Golf elbow does not just happen to people who golf, but certainly can happen if you golf. Hi, my name is Dr. Marc Gruner. I'm a board-certified sports medicine physician. I have treated thousands of patients in my office with golfer's elbow. And today, in this video, we are going to talk about my treatment approach to golfer's elbow and how it can help you recover from an injury. First, what is golfer's elbow? Golfer's elbow is also known as medial epicondylitis. It happens when the tendons on the inside of your elbow become strained or overused, especially right where it hits on the bone on the humerus, the arm bone. This strain of the tendons happens from overuse, especially the ones that help when you flex your wrist and rotate your forearm. Golfer's elbow, or medial epicondylitis, is often caused by repetitive motions like gripping, swinging, or twisting the wrist. This can be from golf or even from throwing or even doing everyday tasks like typing or lifting. Poor technique, weak forearm or shoulder muscles, and suddenly increasing your activity level can all make the problem worse. Golfer's elbow is most common in adults between 40 and 60 years old. This is when the tendons naturally become less flexible and they are more prone to small tears, which can lead to pain and inflammation. How does a doctor like me figure out if someone's pain is from golfer's elbow? To diagnose golfer's elbow, I start with asking the patient a detailed history. I'll ask questions like, when did the pain start? What movements make it worse? And I will ask about the impact that it has on your daily life. After getting the background information, I then perform a physical exam. During the exam, I will find tender spots on the inside of your elbow, and I will check to see if that pain gets reproduced with bending or twisting. I may also need to test your arm strength and motion. Patients often ask me if they need to get imaging tests like ultrasound or MRI to confirm the diagnosis. The truth is that these types of studies are only used when diagnosis isn't clear or you have failed conservative treatment options and we're thinking about other treatments for you. Treatment for golfer's elbow usually starts with rest and avoiding activities that make the pain worse. Ice can help reduce the swelling and discomfort in early stages. Total rest is not necessary, but giving your elbow time to recover is important. Once the pain from golfer's elbow starts to improve a little bit, physical therapy is the next key step. A physical therapist will guide you through stretches and strengthening exercises that target the wrist flexor and pronator muscles. Braces and straps can also help take pressure off the injured tendon during activity. Adjusting your workspace or equipment is critical, like changing your grip size or improving your posture can prevent the problem from returning. If pain continues, non-steroidal anti-inflammatory drugs such as ibuprofen or Aleve can help manage the pain. For patients that don't respond to basic treatments, there are two treatments that can be done. One of them is called PRP, or platelet-rich plasma, which can be an effective option using your own blood's platelets to help heal a tendon. A second option is called a percutaneous tenotomy using a device like Tenex. This procedure is where a small incision is made and then a device is inserted under ultrasound to a diseased portion of the tendon, and that tendon is removed percutaneously while allowing new tendon to form. If all conservative treatments for golfer's elbow fail after 6 months to 1 year, surgery might be considered. The surgical procedure for golfer's elbow includes removing damaged tissue and then reattaching the healthy part of the tendon back to the bone. Most people recover well after surgery and can return to their usual activities with proper rehab. But most people do not need to have surgery done. Golfer's elbow is often manageable with early diagnosis and the right step-by-step treatment plan. What questions do you have about this? Leave them in the comments below and I will try to answer them in a future video. Hope you found this helpful. Remember to hit like and subscribe below, and I will see you in the next video.